Welcome to Alliance Cancer Specialist. My name is Mel, and I'm a registered nurse.
And my name is Gina, also a registered nurse. You may have recently met with your physician and discussed a treatment plan. We understand you may be feeling really overwhelmed and anxious. We are here to help you through this journey and help you understand the fundamentals of cancer treatment.
The healthcare team at Alliance will include a comprehensive group of professionals that will provide care, education, and guidance to you. This team consists of your physician assistants or nurse practitioners, social workers, pharmacists, nurses, medical assistants, lab technicians, patient navigators, and care coordinators. Our business office also has a team that will help you navigate through any financial concerns you may encounter.
Your treatment plan may consist of chemotherapy, immunotherapy, or a combination of both. Chemotherapy is a general term for medication used to kill cancer cells. Immunotherapy utilizes the body's immune system to help fight cancer cells.
These different types of therapies have various side effects, which may be different for each patient. You will meet with a nurse who will educate you about side effects and issues that you may experience during and after your treatment. You'll be provided a take-home folder that will have valuable information regarding how to reach our office after hours, whether you can bring a support person or food, and very important information about symptoms that require a call to your doctor.
Your treatment may be ordered in different forms. Some are quick shots or injections. Others are given more slowly, called an infusion through an IV or a port. These will be given in our infusion suite and are administered by our nurses. A port is a catheter that is placed by a surgeon or radiologist under the skin of the chest to deliver medicine. The port can be utilized for several years and be removed when treatment is complete. It is the safest way to administer chemotherapy and immunotherapy agents. Your nurses are highly skilled at inserting IVs into veins and accessing ports. All of our registered nurses have successfully completed the Oncology Nursing Society's Chemotherapy Immunotherapy Administration course, and we recertify every 2 years.
Other treatments are oral, given by mouth, and may be delivered to your house from a specialty pharmacy, or may be available at our on-site pharmacy, so you'll be able to pick it up at your doctor's office. You'll receive instructions on how to take these medications and educational instructions about the side effects.
On the day of treatment, you will come to the front desk and check in with our patient care coordinator. You may or may not be scheduled to see your doctor, nurse practitioner, or physician assistant the day of treatment. You will then be directed into the infusion suite for your treatment. If your treatment is scheduled to be given over several hours, you may want to bring in a light lunch or snack. Dressing in casual clothing to keep you comfortable is also recommended.
Side effects will differ based on your specific treatment and can vary between patients. Everybody is different and every body is different. You'll be receiving an educational session that will be specific for your prescribed treatment plan. It's critical to remember to always call your healthcare provider if you develop a fever 100.4 or greater, shortness of breath, chest pain, inability to eat, uncontrolled diarrhea or nausea, or vomiting, uncontrolled with medication.
Generally, chemotherapy mostly affects cells that are constantly growing and dividing. Examples of these are hair and skin cells, lining of intestines, and blood cells. We will discuss some common side effect management tips. Mouth sores. Occasionally, treatments may cause sores in the mouth. Good dental care is important prior and during treatment. Avoid using mouthwashes with alcohol and use a soft toothbrush.
Nausea and vomiting. Some oral and IV treatments can cause nausea and occasionally vomiting. To help prevent these side effects, you may receive anti-nausea medication in your IV prior to treatment, and you'll be provided oral medications that you can take at home. In your patient folder is an instruction sheet that outlines how to take these prescribed medications. Remember to take these anti-nausea medications at the first sign of nausea. Your body needs to maintain adequate hydration and nutrition throughout treatment. You should avoid fried, fatty, and spicy foods, eat smaller amounts of food more frequently, sip fluids throughout the day. You may also try popsicles and Jell-O to help your fluid intake. Your nurse is prepared to discuss further ideas on prevention and management of nausea and vomiting. Always call the office if you're not eating well or if your nausea is not controlled with medications.
Bowel changes. Some of the treatments may cause a change in your bowel habits, either constipation or diarrhea. Management of diarrhea is very important as it may lead to dehydration and kidney problems. Your patient care folder includes an instruction sheet on how to utilize over-the-counter treatment medication and prescription anti-diarrheal medication. It is safe to take Lomotil or Imodium every 2 hours if necessary to control diarrhea when receiving chemotherapy. Please call our office if diarrhea is not controlled with medication.
It's important to remember that if you're receiving immunotherapy along with chemotherapy, the treatment of diarrhea is very different. If you have more than 3 watery bowel movements a day on immunotherapy, it's very important to call our office as soon as possible because it can be dangerous and may need to be treated with steroids.
To prevent dehydration, it's important to replace fluids orally. You should try to maintain a fluid intake of 48 to 64 ounces daily. Your fluids may consist of water, Gatorade, and other non-caffeinated beverages. Sometimes drinks at room temperature are better tolerated than hot or cold. Contact your physician's office if you're experiencing symptoms of dehydration. These symptoms may be lightheadedness, dizziness, dry skin, dry tongue, or rapid heartbeat. Your healthcare team may want to administer some fluids through an IV in our infusion suite.
Fatigue. Fatigue is a very common side effect of chemotherapy and may last for several months after you've successfully completed treatment. Remember, fatigue may worsen with dehydration, so again, it's very important to stay hydrated. There are ways to manage your fatigue. This can include low-impact exercise such as walking or yoga, and taking measures to minimize sleep disturbances.
Blood work. We will frequently order blood draws to closely monitor your lab values. It is common to have fluctuations in your lab values throughout therapy. There are times when we may hold chemotherapy for up to a week to allow your body to rest and your lab values to return to a normal range.
Fever or infection. Fever or infection may be a side effect related to chemotherapy if you develop low white blood cell count. Some symptoms of infection may be temperature 100.4 or higher, shaking, chills, cough, congestion, pain, or burning with urination. Fever with chemotherapy can be considered an emergency. You should take your temperature anytime you feel you're warm, flushed, or having difficulty getting warm, such as when you have shaking chills. It's very important that you notify your healthcare team if you're experiencing any symptom of infection.
Hair loss. Not all chemotherapy causes hair loss, but if your treatment does, you may want to plan. Some patients opt to purchase a wig prior to treatment to match their style. Other patients use hats, scarves, or nothing at all.
You may be ordered other medications that are not specifically chemotherapy, such as immunotherapy and targeted therapy. The side effects of these treatments may differ from chemotherapy and will be reviewed with you by your nurse.
Remember, this is just a brief overview of general side effects, and you will be given specific information related to your treatment plan. We will assess you on each visit and review specific items throughout your journey as needed. We are always available to answer questions. We encourage you to write down any questions for your visits to help you remember to ask your doctor or nurse. Do not feel as if you are alone. We are here to make you as informed and as comfortable as possible. We view your health and well-being as the most important part of your treatment plan, and we hope that you find this information helpful.